reimagining food and nutrition education, a strengths-based pedagogical approach. The problem: food and nutrition education in schools has largely been from risk-based perspectives. To encourage healthy eating, I'm going to scare you! Listen carefully. A health class, healthy eating, no lollies, cakes or burgers, exercise daily, otherwise you'll develop disease. My students aren't adopting a healthy lifestyle. What if we reconsidered health education through a strengths-based approach? We found that health and physical education is often not achieving its desired outcomes in schools. We found that a lot of imagery around what it looks like to eat healthy and eat unhealthy is scaring children and often making them despondent to a lot of health education schemes. We believe that this type of health education is not achieving its desired outcomes because it's using stereotyping and presenting extreme and narrow medical views. It employs a worst-case scenario bleak outlook and is also not inclusive of cultures or sensitive to all body types. It can often be death education rather than health education. The challenge: how can we make health education more contemporary through educative and critical inquiry-based approaches? We looked at different issues students are faced with and misconceptions they may have, such as if you eat carbs, you are going to be overweight, or if you eat strictly vegetables, you're going to be skinny and underweight. This was then a springboard for developing ideas for critical inquiry lessons based around health and physical education. For example, when I'm really hungry, why do I crave sugar? Discovery phase: how we approach the challenge.
Our group agreed that we need to shift our thinking around health from a medical perspective around diet and fitness and an ill-free life to a more multidimensional and expansive definition. Our findings found that even the Ottawa Charter and Australian curriculum believe in this more holistic approach, and that health encompasses not just physical well-being but also mental and emotional well-being.
Preparing research.
So our group in this assignment really looked into what about the kids that aren't getting the medals? What about the kids that aren't doing really well at sport? How can we involve them in health and physical education so it serves the whole school community?
We believe that a lot of these negative attitudes towards teaching health and physical education can have a really detrimental effect on young people. We believe that they're flooded with images of what they should look like and what healthy living is, and they lack critical inquiry skills to make good and informed decisions about their health and physical education.
Taking a strength-based approach, which looks at the benefits of adopting a healthy lifestyle, eating well, incorporating exercise into your daily life, and also ways of creating meals to share, and ways of how that can be really beneficial to forming good relationships.
Gathering inspiration.
As we refined our ideas, we agreed that teaching health had to cover more than just nutritional values. It can cover food literacy, food studies, animal welfare, trade, the list goes on. We should have a critical inquiry in our approach. We need to acknowledge the culture of our students and tap into resources from home and understand how social, cultural and economic factors play a role in health choices. We identified health as a standalone subject that needs to be more cross-curricular in order to be more effective.
Ideas for moving forward.
So moving forward with this, personally as a group we're all pre-service teachers, so we plan on going into schools, and we're obviously all committed to this approach, and we'd want to actually personally take a strength-based approach to teaching in our school and also promote it across the school as a whole, so ways of promoting health, well-being and being physically well.
One of our ideas is that we suggest a whole school approach to teaching health and well-being. Here is the Victorian Public Health and Wellbeing Plan with its framework. It involves families, communities, leadership, a healthy physical environment, healthy culture, student teaching and learning, and supportive staff. With a whole school approach and adopting ideas such as a critical inquiry approach to health and physical education, our group truly believes that we can benefit students and inform them so they have the best opportunity at leading a healthy and a happy life.